Another case on this, heard in the Court of Appeal in 2002, was called the Assisted Reproduction and Gynecology Centre case. And it shows how difficult it is to limit doctors and women to the healthy choice of one embryo. Mr. Taranisi, that's him there, the medical director of the ARGC, a London clinic, had a patient, Mrs. X. He and his patient challenged a ruling by the HFEA given at Mr. Taranisi's request. At the material time, the limit on embryos was 3. Mr. Taranisi wished to treat Mrs. X by using 5 embryos in one go, and argued that it was appropriate to make an exception to the rule of 3 in her case, based on her particular treatment needs. Mrs. X was 47. She'd married when she was 41. She and her husband, Mr. Wright, no doubt, were unable to conceive a child. Between 1996 and 2000, Mrs. X underwent 8 IVF treatment cycles at Mr. Taranisi's clinic, in each of which 3 of her embryos were replaced in the uterus. So after using 24 embryos, Mrs. X did not become pregnant. Mr. Taranisi, her doctor, wrote to the HFEA inviting it to consider a relaxation on the ban in relation to using more than 3 embryos in the case of older women. He claimed that the risk of an older woman having a multiple birth was non-existent, but that the use of more than 3 embryos, he wanted to use 5, might give her a reasonable chance of conceiving. The HFEA carefully considered such statistics as there were relating to pregnancies and multiple births amongst women of that age, 47, both in this country and abroad. The HFEA data then, I think still now, show a 0% success rate for women of 46 and over, and 4% at age 43, and this woman was 47. The HFEA found that the birth rate was very low indeed, but where a pregnancy did occur, there was some risk of a multiple birth, all the more threatening to a woman of an older age. So the HFEA stuck to its rule. It advised Mr. Taranisi to follow the Code of Practice, the guidelines. The HFEA was not willing to allow a relaxation in this case as an exceptional one. So Mr. Taranisi and his woman client sought judicial review in the courts. The HFEA argued that it wished to minimize the health risks arising from multiple births, as I've just been describing, and that they'd weigh this against maximizing the chances of Mrs. X's becoming pregnant. It had considered her human rights and the reasons for interfering with them in the interests of society at large. The judges held that this was an area of rapidly developing science in which court intervention through judicial review had a limited role to play. Disagreements between doctors and scientific bodies in this pioneering field were inevitable. The UK had opted for a system of licensing and regulation and had empowered the HFEA to do this and make the decision. Like any other public authority, the HFEA is open to challenge by way of judicial review if it exceeds or abuses the powers and responsibilities given to it by Parliament. But where, as was manifest in this case, it considered requests for advice thoroughly and produced opinions which were plainly rational, the court would not intervene. The fact that Mr. Taranisi disagreed with the advice was neither here nor there, said the court. So here we have an instance of the courts preferring the general rules of public health above the strong desire of a woman to take risks that might enable her to become pregnant. Whether it's a feminist decision is a good question. Is it better for women to be shielded from risky medical practices by the courts when they themselves, the women, would accept the risk? Or is it better to allow them, in consultation with their doctors, to do anything that's legal? My own answer to this is evident from my theme that the woman is a whole and worthwhile person in herself, who should not be placed under too much pressure by modern reproductive medicine advances. And if I can end on a light note, I think the answer would have been to introduce Mrs. X to this gentleman, but I'm afraid he was too far away. We have time, I think, for about 10 or 15 minutes questions, if there are any. Thank you very much.